there a gap? Is there a gap between the ovary and the uterine tube?
No.
Yes. Yes.
That's a trick question because it seems like there would be, but there is.
There is a gap, and that has important consequences, okay? So here's the ovary, where we're making eggs, and this is much enlarged, much enlarged. Although supposedly you can see eggs with your naked eye. I've never seen one.
Really?
Yes, so keep your eyes open.
Yeah, we'll
Those
just,
of you that have eggs still coming out, I don't have that anymore, okay?
we'll just keep an eye out on that.
Nobody lose your placenta, nobody lose your eggs.
Yeah, my placenta disappeared. Okay, so the ovary, that's one of the things you have to recognize under the microscope is the ovary, okay? And it makes the eggs, the follicles, under the influence of follicle-stimulating hormone. Surprise, surprise, right? Okay. Luteinizing hormone is especially important at ovulation. Now, the eggs in here, the ovary is going to make estrogen and progesterone. Estrogen especially causes the female sexual characteristics, you know, the secondary sex characteristics. So when an egg ruptures basically out of the uterus here, only one usually per month from one ovary, the fimbriae here are the little finger-like projections of this uterine tube, which is also called fallopian tube and oviduct. They kind of create little currents that get the egg into that tube. And then the egg starts moving down. It moves by three ways: the little fimbriae, peristalsis, and cilia. So that's how it moves. That answers one of the extra credit questions, right?
So it was cilia, peristalsis, and what was the other one?
The fimbriae here. The fimbriae, little currents that get into the fimbriae.
Fimbriae.
Finger-like projections here. Now, the egg is only viable for 1 day, but the trip here, depending on which book you read, for 3 to 6 days, okay? Depending on which book you read. So you have to have a very ambitious sperm to get up there, because it has to be fertilized in the tube or it's not going to be viable. Once it's fertilized, it starts under... Now, it doesn't finish meiosis either. It's a secondary oocyte. It's not really a real egg yet, unless it's fertilized. If it's fertilized, then it finishes meiosis. And then it starts dividing. When it gets down here, it's called a blastocyst, and it's going to implant in the uterine wall here. Okay. Now the uterus has what we call the fundus, the body, and the cervix.
Oh, so almost like the stomach.
Yeah. So it has the inner lining is called the endometrium. Then a myometrium is smooth muscle, and when you're pregnant, you get more cells and bigger cells, hyperplasia and hypertrophy. And the outside is called the periometrium. Depends on which book you read. And then this is the vagina, which is only, by the way, 4 inches long, except during sexual excitement it gets longer. So consequences of this gap is that the egg might not go into the tube. If the egg doesn't go into the tube and you have a really good swimmer, you could get a fertilized egg out here in the peritoneal cavity. And it's a type of ectopic pregnancy. If the egg doesn't implant in the uterine lining, that's called ectopic pregnancy. And then that's not viable. Okay, that could cause a lot of problems. Other things that can happen, that endometrium lining, which the top layer of it's supposed to slough off and come out partially as menstruation. Instead, it can come up and out and into the peritoneal cavity and go through the monthly cycles and bleed and cause scarring and cause infertility. That's what I had, right? Pain. Yeah, I had that. So I had to take 6 months of huge doses of birth control pills, basically, is what they gave me. A huge dose, estrogen and progesterone. Another thing is you can have a sexually transmitted infection come up and out in here and maybe cause pelvic inflammatory disease, which it also can interfere with getting pregnant and maybe even death. So that's, and then this is called the labia minora, no hair. Labia majora has hair post-puberty, and the mons pubis has hair too. So I should get some little stuff to put on here.
No, don't do that.
No, it gets glue it on.
No.
Now, of course, one of the problems for women is everything's really close together here. So little girls learn, wipe front to back. You don't want to transfer these E. coli that might be around here up here. Also, you have to watch out for foreign agents in the area because they can move things around, especially if one of these goes into there and then goes into here. Okay, that's that too. Yeah. Now, so it's very easy for women to get bladder infections, usually from E. coli, but it could be from fungi too. There's a lot of yeast here. And they could cause urethritis if they go up the urethra. See, that's short and very close to everything, okay? And it could cause a bladder infection and even go up to the kidneys, okay? Wherever they are, you know.
So Dr. Dixon, what happens when you have a cervix that sits lower?
I don't know.
Okay.
Well, I mean,
It moves throughout the month.
Right, when I was pregnant, initially they thought my cervix was too low and they were gonna put me on bed rest, so I was just curious.
I don't know. I know as women get older, often their muscles get weaker,
Okay.
et cetera. And sometimes they have to put devices in to pull things up. Sometimes they do surgery to pull things up.
Okay.
That's all I
Do you
know.
know what this is?
Probably intestines. Okay.
I know, like these are kind of.
Anyway, so,
What's this supposed to be?
well, this is supposed to be part of the uterus. This part broke off. So that's called the fundus, the body,
Okay.
and the cervix.
Okay.
Okay, and we've learned about HPV, which can cause genital warts, and it can also cause cancers, especially like cervical cancer, and there's a vaccine now to help protect against that. Now, what's this? No women now. What's this? Huh?
Clitoris?
That's right, okay. So, gotta pass that, guys, you gotta know that. This is my good deed for the day.
Jesus.
Huh? Okay, and let's see, what else do we want to cover? So when, if you want to keep everything clean here, you want front to back, you want to drink lots of cranberry juice, pee before and after sex. Those are things that help prevent getting bladder, infections.